Good day, and thank you for joining me, Dr. Amir, here at Fortis Health for another insightful session on the topic of testosterone replacement therapy. In today's discussion, we will address the questions and concerns that you, our valued audience, have raised regarding TRT. So the first question that we're looking at is, what is testosterone replacement therapy? Well, I mean, the statements in the actual title. So it's the replacement of testosterone which is either lost, meaning deficient, or insufficient in usually the aging male. However, it's becoming more prominent in some younger age groups, certain cohorts who have actually got other illnesses and ailments that are predisposing them to low testosterone levels. So as one ages, testosterone levels do become deficient or in some cases insufficient, and we would like to look at replacing those levels or at least optimizing them in some cases, especially when they're symptomatic of testosterone deficiency. So presentation of testosterone deficiency in, let's just say, the aging male, because we're looking at testosterone, which is obviously predominantly the hormone that is known to be predominant in men, obviously, and there is also a certain amount of testosterone in women as well, and we can talk about that on another occasion or maybe in another FAQ session like today. When we see men with low testosterone, there's several symptoms they present with. Apart from the physiological and the biochemical parameters that we look at, their presentation as such could be things like low libido, so they have no urgency and no feeling towards having relations. That can put a lot of pressure on men, especially in marital situations, as you know, obviously, or any relationship really, where there can be discord as a consequence of not having intimacy with one's partner, because libido does go down with testosterone deficiency. Erectile function, that's another one. People always think that erections are based on blood supply to the to obviously the erectile tissue inside the organs of erection, being the penis and the like thereof. But again, testosterone deficiency can present with these similar symptoms. Fatigue, patients being absolutely lethargic, tired, no performance, just feel anhedonic, like I just don't want to do this anymore, I can't be bothered. The level of performance goes down in the workplace, in the family, in and about activities outside of work. And on top of that, mood changes. So we're seeing a lot more patients present with things like depression, anxiety. What people don't realize is that testosterone is involved, at least in the facilitation and the mobilization of dopamine in the brain. And there's many receptors in the brain that actually are demarcated by androgen receptors, what's also deemed testosterone receptors, as well as actually estrogen receptors as well. So we know that the balancing of those hormones are key when it comes to one's mood. And as a consequence, you also have, with mood, cognitive function. So people actually feel what they refer to as brain fog. They can't really grasp why they haven't got the energy to, the brain energy to maybe finish a project or a task or some work-based activity. And also one of the key features was decreased motivation. So that's all part and parcel of one's mindfulness. Now, if you look at testosterone presentations and deficiency, there's a key questionnaire called the ADAM questionnaire, which is the androgen deficiency in the aging male questionnaire, which looks at those key elements. And if one answers positive to one of two of those main questions, which would be basically around libido and erectile function, or they're positive to 3 from any of those questions, then there's a high risk of them being testosterone deficient. Alongside the presentation of testosterone deficiency in terms of what the patient comes with, there's physical signs as a clinician that you look out for. So obviously reduced muscle mass, that's one of the questions we ask about. So what patients say is they have an inability to maintain the muscle mass and they lose muscle quite quickly. And obviously they have an increased body fat. So they say to you that I can't lose fat as I used to lose, I've lost my 6-pack, I've got, a 1-pack well, not a 1-pack, but obviously they get truncal fat around that area of the body, and as a consequence they're unable to lose the fat as they used to. They have sometimes a loss of body hair as well, and in some cases when testosterone is very, very deficient, you actually start getting a loss of testicular size, and a worst case scenario actually, as it were to continue from a physical presentation, you can actually reduce your bone mineral density, leading to things like simple fractures as well as osteoporosis. And there are risk factors that we look at as well. So things like diabetes, chronic illnesses, obesity, comorbidities which affect one's illnesses. So other chronic illnesses that we'll discuss, things like autoimmune disease, liver diseases, disease of the body in that respect, and they all can put pressure on your testosterone productivity. We know that even in COVID, there was a great number of patients who, while still peri and even post-COVID, had a loss of testosterone, quite significantly actually. So we look at that, we look at those features when they present to us, and then we start investigating them as we should do.